All right, we'll go ahead and call this meeting to order. If you're able, please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Dee, can you please call the roll?
Director Yee?
Present.
Director Stewart?
Present.
Director Wallace?
Present.
Director Epen? Director Nicholson?
Present.
Very good. Well, welcome to the February 23rd, 2022 regular meeting of the Washington Township Healthcare District Board of Directors to continue to protect the health and safety of the members of the board, district staff, and members of the public from the dangers posed by SARS-CoV-2 virus. The Brown Act allows a local agency to continue to hold its meetings remotely as opposed to being required to meet in person. Section 54953E3 of the Government Code requires that the board make certain findings every 30 days to continue meeting remotely. One such finding is that, quote, state or local officials continue to impose or recommend measures to promote social distancing, end quote. The Alameda County Health Officer continues to recommend social distancing and the wearing of masks indoors. I refer the public to the Alameda County Healthcare Services Public Health Department COVID-19 website at www.covid-19.acgov.org. The board made such a finding at its meeting earlier this month. Public notice for this meeting, including dial-in information, has been posted appropriately on our website. Tonight's meeting will be conducted by Zoom, and I ask that you please mute your system until such time as you need to speak. This meeting will be recorded. Moving on to communications. Members of the public are invited to speak during oral communications. When prompted, please state your name for the record, then proceed with your statement not to exceed 3 minutes on issues or concerns not on the agenda or within the subject matter of jurisdiction of the board. Are there any members of the public who would like to speak at this meeting? Okay, hearing none. Do we have any written communications, Steve?
No, we do not.
Okay, very good. Well, let's move on with our agenda. Beginning with a presentation. Kimberly, can you introduce that, please?
Yes, thank you, Madam President. We have an important presentation this evening that Angus Cochran and Chris Henry are going to give. And basically, it's a consideration of district financial condition and potential resources. But before they move forward with that, I would like to give some opening remarks that I have put together and on this important topic. So I'm going to move forward with reading these. Over the last 2 years, Washington Hospital Healthcare System has experienced the most unprecedented medical and economic challenges in its history. Through the hard work, resilience, and compassion of our staff, medical staff, volunteers, and the leadership of this board, we succeeded in fulfilling the healthcare needs of our patients when they needed us the most. When the supply chains failed, when we saw sharp increases in labor costs, when we needed state-of-the-art equipment and personal protective equipment to protect our nurses and doctors, we worked collaboratively to face these challenges head-on. As a consequence, I am proud to say that we were successful, but our finances were severely impacted. Despite receiving some financial help, we learned that we could not depend on the state or federal governments for ongoing assistance. In this evening's presentation, the board will learn our thoughts about what it is going to take to ensure that Washington Hospital Healthcare System continues to serve this community now and into the future as an independent, full-service community healthcare system. Healthcare is local. This is our founding premise. We must be ready for the next pandemic or natural disaster. We must be ready to provide our community with local access to high-quality emergency and critical care services so that our residents can receive the care they need without having to leave our community, again, now and into the future. This responsibility has financial consequences. As you are aware, supply and labor costs continue to increase, and the money we receive for our services does not pay for our costs. It does not cover our costs. The hospital is open to everyone, regardless of their ability to pay. Many of our patients rely on Medicare or Medi-Cal for their health care. While we are grateful for the reimbursement from these programs, the revenue received from these programs reimburses the hospital at a rate well below our actual cost to provide care. As your Chief Executive Officer, it is my responsibility to provide you with information and options so that you, as the Board of Directors, can consider what is best for the district. As you will learn in tonight's presentation, the Board has the option to consider a parcel tax. Other healthcare districts have parcel taxes, but I recognize that this would be precedent-setting for our district. We are extremely grateful for the past support of our residents. I can assure this Board that I do not present this option for additional funding lightly. We have done polling, and we believe that our residents would support a parcel tax. We believe that the support is there because the healthcare system has shown time and again that it has been here for this community. For this fiscal year alone, it is estimated that we will see over 54,000 emergency room patients. We treated to date approximately 1,500 COVID inpatients. In part, we were able to do so because we prioritized the construction of negative air pressure patient rooms, essential for the treatment of COVID patients and the safety of our nurses and our doctors. And we opened our vaccination clinic to all residents and workers in our community, administering over 85,000 vaccinations to date. In the meantime, we have enhanced the provision of world-class care through the continued growth of our affiliation with UCSF and proceeded with many other initiatives, all to continue our mission to provide the best and highest level of locally available health care. In conclusion, I want to make this clear. We have a wonderful healthcare system, and every day we work to make it better. But we have to face the realities of today's financial challenges and also consider our future. That is why this item is here before you tonight, a very important item. Now, I'm happy to answer any questions that you might have before I turn over the presentation to Angus Cochran and Chris Henry. Do you have any questions for me? All right, I think it's important that we move forward with the presentation on this important issue, and I'm going to have Angus begin. Angus, you're muted and you need to share your screen.
One of these days I'll learn. Here we are. Let me share my screen. Hopefully you can see my screen now. Oh, here we are. Here it comes.
Yeah.
Hopefully now. Yeah. Okay, great. Thanks so much, Kimberly. Yeah, so this afternoon, this evening's presentation really speaks a little bit to potentially other avenues of revenue for the organization. And I thought I'd begin with the people who we serve, which is the population of the district. The district has clearly grown substantially through the second half of the 20th century and into the first couple of decades of the 21st. We currently have about 350,000 residents. And the Association of Bay Area Governments projects this growth will continue and surpass 400,000 by 2040. And it's really, these are the people that we serve, and it's really this population that has driven the growth of the organization and the health system. We had to keep pace with this growing population, and we've had to expand our facilities that house our life-saving services. And residents have repeatedly shown that they will invest in the local healthcare. And that's really what's driven our expansion. And particularly the building that you see here, the Morris Hyman Critical Care Building, which was opened in 2018 and houses our emergency department and critical care building and our med-surg building, or med-surg unit as well. This building really inaugurated a new era in healthcare. We knew we'd outgrown the previous facility, but we really had no way of knowing that less than 2 years after the building was opened, that the CCU would be at capacity with COVID-19 patients. This new facility really literally gave patients and nurses, doctors and nurses, the space to save patients during the pandemic. And I think this picture of Dr. Aquilili in the yellow isolation gown on the right kind of speaks to the level of care that we provided in this building and the lengths that we went to make sure our patients and our staff were safe. In the background, you can actually see the devices that our engineering department put in place to create this negative airflow system that vented the room to the outside. And the next phase of construction will also support the community's wish to keep healthcare local. Planning has begun on a new patient tower designed to withstand significant seismic events. And this is really at the heart of all the work we do. We have to plan for future disasters, future public health emergencies, and all these things are engineered into the buildings that we produce and that we create. There are state regulations that require us to do these things without paying for them, but they are also at the heart of our service to the district residents as well. This picture here really shows the schematic or the kind of where the new inpatient tower will go. And in addition, we also have a project to build a bridge from the main hospital to the Hyman building and build out our cancer center as well. And in general, I think just as we've built new facilities in response to the community, we've also expanded our services. We are a full service community hospital offering a wide spectrum of services locally. You can see many of them here on the slide. And our latest clinical development is our bid to obtain trauma center designation from the county. Our application has been submitted and is under review at the moment. And we've been preparing for this for over a decade. We have 2 trauma rooms in the emergency department. We have the personnel with the expertise to be able to operate this kind of a service. And it's really something that our community has called for and when they've supported the construction in the past. This is really an attempt to make sure that anyone with a traumatic injury doesn't need to be transported to Castro Valley or San Jose in an ambulance in traffic. And for many, year in and year out, the emergency department is the front door of our organization. You can see the consistency with which we see patients. As Kimberly mentioned, that we expect more than 54,000 patients to come to the ER this fiscal year. It dipped obviously during the pandemic when people were anxious about coming in, but it's been a very steady utilization throughout the years. And again, we really just want to emphasize that in a time of disaster, we've been here for the community. We couldn't anticipate the pandemic, but because we prepare for these types of things and for disasters, we had the policies and procedures in place to guide our response. We had the facility as well, thank goodness, that allowed us to kind of manage the pandemic as smoothly as we possibly could. And the pandemic is just one example of how we prepare for public health emergencies and floods and earthquakes, anything you can think of that our job is to do disaster planning and imagine the worst case scenarios. Again, the foresight of the community and investing in these buildings has really enabled us to have a safe response. And then when vaccines were developed, we quickly set up our vaccination clinics for all of our residents. And regardless of their insurance coverage, we gave them a shot. We've done over 85,000 vaccinations. And over 5,000 Kaiser members have been welcomed at our centers as well. So it really is, we open the door to all comers. Now, obviously this comes with a price. And for that, I'm going to turn it over to Chief Financial Officer Chris Henry to talk a little bit about the financial implications of all this.
Yeah, thank you, Angus. As Kimberly mentioned, the provision of care is coming at a increasingly steep price tag, and labor costs is really the clearest example of this. From fiscal year 2015 to what we're estimating for fiscal year 2022, labor costs have increased about 33% from $247.7 million in fiscal 2015 and a projected $328.5 million for fiscal year 2022. We do expect that labor costs will continue to rise at an accelerated pace due to the current high wage inflation and staff shortages in the coming years. And by the way, just for reference, labor accounts for approximately 60% of our total costs for the healthcare system. Next slide, please, Angus. Taking this down to a little bit more of a micro view, the emergency department, currently we kind of have the perfect storm of costs escalating faster than reimbursement. Our ED has operated at a loss for some time, but the situation has worsened dramatically in the current environment. Labor costs are on the rise, as I mentioned. Salaries and wages in the emergency department increased 31% during fiscal years 19, 20, and 21. Supply costs have also increased over that period. Supplies per visit in the emergency department rose 44% during these years. Reimbursement, however, is not keeping up with those costs, with reimbursement from all payers increasing only 2 to 5% per year during the same period. We do expect these losses to continue into the foreseeable future as high inflation pushes up our costs and acuity increases as the population ages. Next slide, please, Angus. Thank you. So the financial climate for all hospitals right now is extremely challenging. Since 2015, as costs have been rising faster than reimbursement for Washington Hospital, while the emergence of COVID-19 exacerbated the situation, the general trend was already with downward pressure on the bottom line. We were fortunate to nearly break even in 2020 due to the receipt of $30 million of federal COVID relief funds in that year. Without that funding, fiscal year 20 would have looked very similar to what you see for fiscal year 21. We have not received any additional material funding since fiscal year 2020. We are very grateful to have received those funds, but the story remains the same. We've made great efforts recently to improve throughout this period, to improve our financial performance through operational efficiencies, program growth efforts, and contracting. We've made significant progress, but we expect to still fall short in 2022. We will continue this work, but inflationary factors continue to increase our labor, supply, and service costs. Increases in reimbursement continue to significantly lag the increases in costs from all payers, including government sources and private insurance. Our experience in this environment has taught us how quickly a disaster can impact our financial health, but absent that, the environmental challenges are significant, highlighting the need to continue improving our operations and to seek stable sources of funding in order to continue to remain relevant to the community. So I'll turn that back over to you, Angus.
All right, well, thanks, Chris, for that update. Obviously, all this activity comes with a significant price tag. I want to turn for a second now to some surveying that we did at the end of 2021. Obviously, as a district hospital, we pride ourselves on keeping a very close contact with our residents. It's been a little more challenging during the pandemic, though. So last year, we polled community members to gauge their perception of the health system. And I think, as you'll see from these data slides, the good news is that throughout the 2 years of the pandemic, we've maintained our role as a highly valued community asset. The top two issues valued by the community are emergency medical care and disaster preparedness, perhaps not unsurprisingly after 2 years of pandemic. 87% of respondents thought that having local emergency medical care was extremely or very important. And 86% of everyone we talked to thought that being prepared for disasters, both in the community and in the hospital, was crucial as well, extremely or very important. Residents also voiced how much they value having leading edge medical technology available here. 87% thought that medical technology and current medical technology is very important in a local community facility. And like our residents, we understand also the value of providing cutting edge medical technology to stay relevant to the community. And finally, 90%, a whopping 90% of respondents say that access to life-saving care is extremely or very important. So almost unanimously, our neighbors want us here to respond to emergencies and to provide access to local life-saving care. So just to sum up for a second, when you look at the narrative so far, you can see that we've had solid financial performance since we opened in 1958. The community clearly values the health system most highly for its emergency services and disaster preparedness. The financial outlook, as Chris said, is worsening due to cost escalations, uncertain reimbursement, and an aging population. And meeting the needs of the community comes with financial consequences, as Kimberly noted. And this brings us to kind of thinking about potential solutions and for future financial sustainability. And obviously, as board members, you will be considering how to be relevant as a community hospital and consider every possible avenue of financial support. There are clearly financial consequences to meeting the community's growing need for local healthcare. And one option that the district could look into, as Kimberly said, would be to ask residents to approve a parcel tax. Parcel tax proceeds can be used for hospital operations and technology, like those listed on this slide, whether it's in the emergency department or operating room or for public health emergency preparation. There's a myriad of operational expenses that parcel tax can be used for. And then, so it really brings us to the question of why would the district consider doing this now? The healthcare system is currently on a good financial footing, but as Chris painted the picture, we're faced with a scenario where the financial outlook is uncertain and the population we serve is growing and aging. Residents' need for local healthcare will inevitably expand, while our ability to deliver that care may be constrained by our finances. So prudence really dictates that we look to the future and plan for financial contingencies as well as global pandemics. And consideration of a parcel tax would simply open up another financial avenue to keep the healthcare system relevant and keep cutting edge life-saving medical care available locally. So obviously, looking at a parcel tax only makes sense if it generates sufficient revenue to support the hospital's needs. And we can anticipate that costs will continue to increase and the state will continue to impose additional regulations that it doesn't fund. If the board were to decide to ask the residents to consider a parcel tax, we believe it could raise between 5 million and 10 million per year, which equates to roughly about $48 to $96 annually per parcel. Asking the residents of the district for tax revenues, of course, brings an additional burden to those of us on the staff side, knowing that we need to generate additional revenue through services and operationally and run the hospital as efficiently as possible and be good stewards of the district's resources if this were an avenue we were going to approach. And then finally, just about finished here, but there basically are two ways that a parcel tax could take effect. Obviously, there are two mechanisms. It requires a vote of the district residents. Because it's a tax measure, it would require 2/3 majority if the district places a parcel tax measure on the ballot. But if a citizen committee took the lead, it would require a simple majority to pass and go into effect. So my last slide, basically our request of the board today is to consider further investigation of a parcel tax and to direct staff to research and prepare potential parcel tax measure. With that, I'll turn it back over to Kimberly and ask if there are any other questions.
All right. Thank you, Angus, and thank you, Chris, for the presentation. I do just want to say again, we wanted to lay out the picture of where things stand with with the healthcare system today and look at how we feel there's a path forward in terms of continuing to be a strong healthcare system and be able to be here for all of our community now and into the future.
Kimberly, I just want to say that our history is that our residents and our district, we've always taken care of our own business. And we have done that well. And the hospital has served the district residents well, and the district residents have supported the hospital well and deservedly so. The reality is that if we don't care if we don't care by ourselves, I'm talking like Joe Biden now, God bless him. If we don't care of the healthcare needs by ourselves, we'll be stuck with the whims of Sacramento, the county, or the federal government, and we've been let down by those folks. And so, frankly, the reliance on those resources, they're like dogs that don't hunt. It doesn't work. And we've never really had to really depend on them. And if we've learned anything at all from the COVID pandemic, we've learned some very valuable lessons. And those are the importance of local control, critical care access, and the importance of it for our community members. So I am entirely in support of a parcel tax, an ongoing parcel tax, because there is, who knows what will happen next in our healthcare future. We know that we are faced in a very high cost of living area, and I think it's important that we stay relevant and we stay with the highest and best equipment and staffing to serve our community needs. So I think a parcel tax is really needed. That's my 2 cents about the matter.
Thank you, Director Wallace. I appreciate your comments. Any other comments from Dr. Nicholson or Dr. Stewart?
Yeah, I would concur with Mike that I think parcel tax is a very wise way to move forward, because it reflects the way we've responded to the needs of our community and will allow us to continue to respond to the needs of our community. And I think Mike said it very well, that local control is really important. And having the funds from a parcel tax will allow us to continue that local control and be able to continue those essential programs. As I work in the hospital and see patients, I just think of all the different programs that are so essential to providing that care. And should a financial squeeze come, it becomes very hard to decide which of those we would have to omit. I don't want to do that. I don't think that would serve our patients well. I don't think that would serve our community well. So we're here because the community put us here. And that was a decision made back in 1948 by the community, and they've supported us well over the years. The challenges will not stop as far as the financial challenges, and I think the parcel tax is one way to help support the necessary programs and services and personnel and equipment that are needed to provide the best of care to everyone in this community. So I'm fully in support of a parcel tax.
Thank you, Dr. Nicholson.
I also would like to speak to that issue. I agree with Mike. I agree with Bill. This is a very, very important issue. and one that we really need. As horrible as this COVID pandemic has been, it has taught us to be prepared and to be in a position that we can do really remarkable, important things. We've come through this pretty well, but it's shown the weaknesses that are in the system. And a parcel tax would help immensely in preparing us for those kinds of things. It's particularly dangerous, I think, for us to be just on the very edge of financial difficulties, on the very edge of not being able to provide care. And we don't know the future, but at this point, we know many things based on what we've seen here in the past. And we know that we can't rely on the federal government. We know that we can't rely on the state government, nor the county. And we need local control over our lives and the health of our community. I am particularly proud of the fact that of the vaccination clinic that's been existing now for a number of a year or so. 5,000 of those patients were Kaiser patients. We have truly served the community. I think that we can all be very happy and pleased that this hospital has been a hospital that supports the entire community, come what may. And a parcel tax would go a long ways towards giving us the stability we need for the future.
Thank you very much for sharing your thoughts on the parcel tax issue. We don't take this lightly. It's not a decision we take lightly. We know it's not going to be easy, but it's been something that we will need going forward. Whenever you face challenges like we faced, it can reveal your weaknesses and it can reveal your strengths. And I think as a healthcare system, because of the leadership that we have seen our strengths really come through. And we have a lot to be proud of. And I think understanding the financial challenges, I have to admit, before becoming a board member, had a very naive view of hospital finance. And now I have a more sobering understanding of the need for this kind of strategic planning for the future of unknowns. And so I too stand in favor of moving forward with all these considerations for the parcel tax. We know we have a couple of options, but let's move on with a motion, if I may, regarding the consideration of this.
I'm happy to, Madam President. In accordance with district law, policies, and procedures, I hereby move to direct the staff to research and prepare a potential parcel tax.
Very good. Do you have a second?
Second.
Second and a third. I heard Dr. Nicholson first. Thank you. Okay, Dee, can we have a roll call vote, please?
Director Yee.
Aye.
Director Stewart.
Aye.
Director Wallace.
Aye.
Director Epen. Director Nicholson.
Aye.
Very good. That motion passes. We thank you for the work that the staff is going to be doing. Look forward to hearing more in the future. Very good. Thank you. Okay, next we have an action item. Kimberly, you want to move ahead with this?
Yes, and I do just want to thank the board for their support on that important initiative. We have another important initiative that we are bringing forward to the board this evening, and it is a relationship with UCSF and basically to bring academic medical care and specifically oncology care to our community. And as you know, one of our focuses has been to bring the care here locally that we can. And I think this is another example of that. And so I'm going to have Donald Pipkin talk about the relationship that we have with UCSF and talk about what is being proposed this evening before the board moves forward with with the next action item.
Okay, thank you, Kimberly. I'm just sharing my screen, so it should show up shortly. And good evening to the board. So as Kimberly mentioned, I want to discuss a little bit about a potential relationship with UCSF Health around the cancer care services here for the district. So we'll quickly review the mission and vision of the healthcare district, our history of cancer care here at Washington Hospital, a brief history of our overall affiliation and how that is focused around cancer care over the last few years, some potential benefits of a joint venture between Washington and UCSF Health for cancer, and what that process and timeline looks like. So as the board well knows, the mission of our district is to meet the healthcare needs of district residents, and doing this through developing mechanisms to respond to the identified needs and healthcare needs of the community, providing an integrated delivery system, and also partnering with a diverse medical staff, including academic medical centers and other providers, to meet the healthcare needs of the district. And to support the fulfillment of that mission, the district's strategic vision is to be the regional medical center of choice in Southern Alameda County, offering quality services that span the full range of care within the available financial resources. Washington has a long history of providing high-quality cancer care services to the residents of our district. We've been accredited by the American College of Surgeons Commission on Cancer since 1993. And in fact, we've received the Outstanding Achievement Award for the last 3 survey cycles for 9 years. Since 2012, we've been designated as a breast imaging center of excellence by the American College of Radiology. And we have a breast navigator program for patients as they access services throughout the system. We also have an interdisciplinary team of physicians, highly trained and specially trained certified oncology nurses, and other clinical experts. We have site-specific programs such as the breast cancer program I mentioned and the lung screening program as well. We have developed and built a state-of-the-art women's center and outpatient imaging center on the hospital's campus. We've also built the Sandy Amos RN Infusion Center, which provides really a comfortable, tranquil environment for patients who have to receive infusion services. We have a radiation oncology center that has the latest in radiation oncology technology and treatment options, and we have interventional radiology physicians who offer many options for the least invasive treatments available. In addition, we have clinical research programs with expanding access to active clinical trials. And in our 2020 Community Health Needs Assessment, cancer was identified as an ongoing community health concern. Washington and UCSF affiliated about 6 years ago, and as the board passed Resolution 1133 in 2013, about 8 years ago, we shared a vision with UCSF to improve efficient access to patients to and from the district when they require tertiary services, decreasing hardships on patients and families by providing that higher acuity care locally to reduce the need for residents to travel extended distances, to collaborate to enhance the availability of specialty services locally through program development, and sharing best practices to further improve the quality of care. This has been a very successful affiliation for the district. Initially, it focused on maternal child health, including pediatrics and neonatal intensive care. And over the years, it's really grown to include services like cardiac surgery, genetic counseling, prenatal diagnostic care, and medical students through pediatric clerkship and pediatric hospital fellow rotations as well in the hospital. We've also recently developed structural heart clinics and procedures, electrophysiology, and we're also working on the co-development of a future outpatient center in the Warm Springs Innovation District that's expected to open in 2024. The affiliation of cancer really started in 2016 when we expanded that affiliation with the employment of 2 physicians and the opening of the UCSF Washington Cancer Center in January of 2017. And as you can see, we're on an upward trajectory in our affiliation with UCSF for cancer care. What I want to speak with you briefly about tonight is a proposed joint venture between the district and UCSF Health on initially radiation oncology, and ultimately the Cancer Center and Infusion Center as well. We really share the vision of combining our strengths, that of UCSF and Washington, to become the leading program in the region, providing world-class care to oncology patients close to their home. As I mentioned, Washington has a long history of providing outstanding cancer care to our community independently, and that's highlighted by our Outstanding Achievement Awards, the great staff of physicians, nurses, and other clinical staff, our site-specific cancer care programs, our outpatient imaging, our radiation oncology centers, the infusion centers, and a very high-quality patient experience. The hospital has done an excellent job of meeting its mission of serving the healthcare needs of the district residents. Similarly, UCSF has a nationally designated comprehensive cancer center. It's a major academic medical center. It's internationally recognized for its cancer programs and its clinical research programs. It has truly world-class cancer subspecialists and cutting-edge diagnostic and treatment modalities. And they have proven over the years that they have a commitment to effectively partnering with not only the district and the hospital, but also with community physicians in the care of the patients. And combined, our vision is to provide excellence in oncology together, to provide an outstanding patient-centered care experience, really to be a regional destination for cancer patients in Southern Alameda County, and a high level of patient satisfaction. To this end, there's a proposed joint venture for the board's consideration. Currently, we have three key components to the service line of cancer care. We have the Washington Radiation Oncology Center, the San Diego Infusion Center, and then, of course, the UCSF Washington Cancer Center. The joint venture is proposed to proceed in two phases. Phase one would include the Radiation Oncology Center, and simultaneously, as we complete the due diligence for that, we would also be working on completing the due diligence for phase two, which would include the Infusion Center and the Cancer Center. Washington and UCSF would joint venture through a limited liability corporation, and UCSF physicians would staff the spectrum of services for cancer care. This joint venture really delivers on that strategic vision of collaboration and affiliation that Washington and UCSF have together. It has improved access to tertiary services, decreases those hardships of patients needing to travel and bringing the care here to the district instead, and then enhancing the availability of specialty services locally through very specific program development. So the timeline we are looking at is we are in February, and this review of the proposed joint venture. Staff has been working with council and UCSF leadership on a number of agreements that are associated with the formation of any joint venture. And if approved, phase one for February would include the letter of intent and the contribution agreement for the joint venture. And if approved and the CEO is able to execute those in February through June, we would complete our due diligence for phase one, which would include radiation oncology. And then we would complete our negotiations and execute remaining joint venture agreements that we bring to the board at a future date. And this would include the limited liability, operating agreement, management services agreement, professional services agreement, et cetera. In addition, as part of the due diligence, we would be transitioning the Radiation Oncology Center to a hospital outpatient department, which involves application with the California Department of Public Health for that licensure change, and that can take anywhere from 3 to 6 months at least. We would also finalize that phase two for the Cancer Center and the Infusion Center, and then we would prepare for the initial joint venture commencement of phase one in July of 2022, and we would have to determine what the phase two implementation timeline would be at a future date. And so what we are asking for today is the board's consideration of approval of the ability for the CEO to sign the letter of intent and the initial phase one agreement, the contribution agreement. And with that, I will take any questions or hand it over to Kimberly if she has any additional comments.
And I also do want to say we have Nicholas Kozachenko here who, in terms of if there are any questions regarding the agreements, he can answer those also. So that is what is on the agenda for the action item this evening, Madam President.
You're muted, Jenny.
Muted.
Thank you. Thank you. I just wanted to thank Tina and Nicholas and Donald for the work, that work that's going into preparing all these necessary documents in this critical window of time with UCSF. Any comments from the board before we entertain a motion?
Yeah, I just wanted to say, I think this is a great example of what we do so well. And is a result of our local control and our ability to make these kind of decisions and form these kind of partnerships. Here we get really the best of both worlds. We get the expertise and therapeutic resources of a world-class university, really one of the top centers in the world. And we get to deliver those services right here in our community under our local control. So I think this is just a great example of what our district has been able to do so well over the years. So I'm fully in support of this.
This is very, very exciting. I could hardly keep my seat here listening to all of the possibilities. Our population around us is aging. Fortunately, I haven't aged, but everybody else is. And as we move into that future, cancer care is going to be extremely important. More and more and more. It can't help but grow and be more needful from our community. I'm proud to be part of bringing this to pass in our local area. Again, as Bill has said, local care to local people from a world-class organization. What an exciting thing to see come to pass. I'm very much in favor of this.
Yeah, I want to say that I have personal experience, not me personally, but friends that have had the benefit of the services that UCSF has provided, whether it was a neuroscience center or the cancer services that they have provided. So this is not like a new something relationship. This is something that has been going on for some time and quite to the benefit of many, many people that I know and love. So I am also very much in support of continuing and expanding the relationship with UCSF.
Wonderful. It is a wonderful collaboration. May I have a motion regarding the consideration of this resolution number 1236, the joint venture with UCSF?
Yes, Madam President. In accordance with district law, policies, and procedures, I hereby move the board approve resolution number 1236 to authorize the chief executive officer to enter into certain agreements related to a proposed joint venture with UCSF for a joint cancer center.
Very good. Second?
Second.
Very good. Thank you, Dr. Stewart. Roll call vote, please.
Director Yee?
Aye.
Director Stewart?
Aye.
Director Wallace?
Aye.
Director Epen? Director Nicholson?
Aye.
Very good. That passes. Keep running, everybody. You're doing a great job. Thank you.
Thank you.
Any announcements, Kimberly?
No announcements.
Okay, very good. Then we will now go into a closed session. However, before doing so, I want to let the public know that they have a right to know what reportable action, if any, was taken by the board during the closed session. Normally, the board would make that announcement following the closed session. As we do not know how long the closed session will last, we do not want members of the public waiting indefinitely on the phone for the board's report. Therefore, we ask that you contact the district clerk tomorrow. She'll be happy to respond to any inquiries about reportable board actions. Our minutes will continue to reflect any reportable actions taken. Thank you. The board will now adjourn to closed session.